India has vaccinated over 43 lakh people today. In all, over 8 crore people have been vaccinated and we are moving at a breakneck speed. Even so, many feel it's not fast enough to keep pace with the number of infections, the COVID-19 infections that are spiking. The second wave is here, it's hitting us hard and it's leading to the question time and again that can we now begin to vaccinate more and more people? The major difference between last year this time and right now is that we have the vaccine, but is there enough of it? Can many more people be covered? Joining me today to answer some of these questions is really the biggest newsmaker, I would say, because everyone wants to know about the vaccine. I'm speaking now with Adar Poonawalla, CEO of the Serum Institute of India, the largest vaccine manufacturer in the world and the maker of Covishield. Adar, thank you so much for taking out the time and speaking with ET now. Let me get straight to the point. There is a request from the state of Maharashtra to increase vaccination above the age of 25. Delhi wants to increase the age of vaccination to all adults. Many different constituents say that we need to be vaccinated as well. The question is, do we have that many vaccines? Can you give us a sense of what capacities we have right now?
So, these are the hardest questions any government or body that is trying to equitably manage everyone's needs, not only in India, but globally. So if we just go back to, the role of what Serum Institute has to play, which is a global vaccine supplier. Today, you're talking about states. I've got heads of states of every country requesting the Indian government and Serum Institute of how we can supply vaccines to them, which we have been doing. But now, with the surge of cases, and the legitimate requirements of the people of India, the Modi government and Serum Institute have agreed, along with other vaccine manufacturers, to prioritize temporarily the needs of India before anything else. Now coming to your point of questions of the requests made by individual states. Now this is a slightly more tricky area because as the health secretary of our country also mentioned that we have to cover the vulnerable first, whilst also trying to find ways of cutting transmission, etc., etc. Now, do we have enough vaccines to cover everybody? Absolutely not. Nobody in the world has it. No country has it. We don't have it. Because you're talking about 1.3 billion people multiplied by 2. We have a capacity of 60 to 70 million doses, which we hope to ramp up in the next 2 to 3 months, partly with the government proposal and that we're discussing with them and through borrowing money from banks to build an additional plant and facility. Now that will take at least 3 months to churn out product. In the interim, we're relying on our existing capacity and other vaccine manufacturers in India who will also supply some doses. So this is where we are at the moment. So for anyone to take a decision arbitrarily to say, let's just open up more than this age group of 45 is a very tough decision to make. There is no right or wrong answer. Right now, we have to go with what we have in hand, which is the vaccine supply, which is also the vulnerable people that you have to protect before the younger population. So these are all the kind of things that the Indian government has to decide and grapple with at the moment.
Let me come more specifically to capacities. You're talking about 60 million capacities. You have said in our previous interviews that you were hoping to increase this to 100 million by February. What are the causes of delays that we are seeing? And do you have a timeline in mind for when these new capacities can be added?
So, at that time when we had the fire, I must clarify, on the 21st of January, we said the existing vaccine capacities would not be affected. In March, we wanted this extra capacity to come about for India and, global capacity. That has been pushed back because of the fire by 2.5 months, which is why in June you will get that additional 40 to 50 million doses per month coming out. Now, We're trying to claw that time back as much as possible, but it's an 85-day cycle from the time you start manufacturing. So if we start today, it will take us 3 months from today to deliver those doses in a filled, packed, tested form, which can actually go out to different states. We never imagined that we would need so many doses in India because we didn't see this kind of surge happening. Even if you go back in the month of December, January, the cases were sort of under control. And we had these little peaks and troughs. But now we've seen an unprecedented amount of cases coming back, records of cases in certain states like Maharashtra and some others in India. So this is where this new challenge is coming. And our Novavax product, which is called Covovax, we hope to launch by September, as I mentioned as well. So this is where we are at the moment.
I just want some clarity on, supplies of raw materials coming in from the United States. There were reports earlier this month, or I would say actually early March, that Serum Institute of India has written to the government saying that because of new rules put in place in the United States, some raw materials were not coming in as expected. Is this still the case?
Absolutely. In fact, this was one of the reasons also why the delay is happening, and more so for Covovax than Covishield. And that is because if we don't get those critical raw materials by this month onwards, we are actually losing capacity. We would be only able to produce half of what we can. And this also ties into the fact that when I had said in May, June, we could make, 100, 110 million doses, that was also including certain volumes of Covovax. So the US embargo on export of critical raw materials like filters, bags, and other things, certain media solutions, which are of the highest quality, and vaccine producers like SII and others in India depend on those raw materials. We're going to be struggling with those supplies. So, I've made it public. I've done whatever I can, including the Indian government, which is helping us trying to explain this situation to the US government. We're going to see that impacting our production from April onwards. And, the obvious question is, but surely there are other people who can make these raw materials. The short answer is yes, but that takes 6 months to implement in your process, validate it, and show that your final product remains unchanged. So, whilst we're addressing that issue in the medium to long term, that's not addressing the crunch which is there now, today, that we need more doses in the next 3 months. Because after that, anyway, you're going to see more vaccine supply coming from us and from other companies. So you see that the real emergency is for this situation right now for the next 3 months.
So this will, just to clarify, if we don't get these raw materials, if Serum Institute doesn't get these raw materials and this doesn't get resolved in a month, will this start impacting the production of Covishield as well?
It's very marginal on Covishield, so I would say no. The main scaling up of Covishield is depending on us being able to use an additional facility which was never planned for Covishield, so that we can scale that up by June. Covovax is what's going to be impacted. But again, you may say, but then how does that really matter? It does matter because what we would have stockpiled in the months of April, May, June is now going to be affected. Because ultimately all this volume would have come to India and other countries, and that gets affected.
Adar, I must ask you, because I know Serum Institute has said this before, you have said this before, that you're not looking at as manufacture of this vaccine as a business proposition. You're doing this to save lives and your duty to the nation, etc. But the fact is that this is a business that requires investments. Is there enough incentive right now for you to ramp up capacity? There was a projection that Covishield would be sold in the private space at 500 rupees a dose. It's pretty much capped at 150 rupees. How does that work out for you?
So initially when this was agreed between vaccine manufacturers and the government of India, we have done it with the view that we need to support India during this crisis. Profits can be made after a few months when it opens up to the private market and the 1,000 rupee price or whatever price we end up setting then. Right now, we need to support the Modi government in this Herculean task of vaccinating everybody and protecting the poor, the vulnerable, and everyone else. So the vaccine industry has sacrificed billions of dollars of profits because we want to support the Modi government in this endeavor in providing this vaccine at this price. Now, this is a temporary measure for a few months. This is not sustainable for the long term. Everybody understands that. Even the government of India understands that and is supportive of that. So this is where we are today. And we have done this in the interest of the nation, to be short and precise in that. The average price for this commodity is $20, $30. But we don't care about that. We're doing this to support our nation in a time of crisis. And then we'll see after 2 or 3 months when we can review all of this to a more sustainable level where the industry can innovate, can use its profits to build more factories for the future, to employ more people. All that we're hoping to do after a few months. This is just a temporary phase where we need to do what the nation needs us to do.
I need to ask you about a couple of important things, and one of them is the mutations. It's not quite clear whether mutations are responsible for this huge second surge. How many mutations are out there? Does Covishield work on these mutations? Part A. Part B, for how long? Will you require a booster or another shot, another round of vaccinations in a year or so? Do we have clarity on these parameters now?
Well, not fully yet, because we need time to pass to know how, and I'll answer both your questions, starting with how effective are the vaccines, for how long, what is the duration? Right now, we know Covishield is effective for 8 months because we have data from the UK and other places. At least 7 to 8 months. Whether that needs another booster, we don't know yet, maybe. And I know other vaccine manufacturers are looking at giving a third dose. Some of them already are giving a third dose. So we'll have to wait and see on that part. With regards to how well does it work against the other mutant variants, we've already seen a lot of UK variant cases happening in India now. And we have seen also that a few people who have taken the vaccine, despite being infected with the UK variant, have not had to go to hospital. They've experienced mild to moderate symptoms, little fever, little headache. We're hoping that trend continues because that will also prove efficacy against these mutant variants, like Covishield has already, against the main Wuhan variant, what we call the original strain, whereby more than 95% of the people who've taken the vaccine and who've come into contact with the COVID-19 disease virus have not had to go to hospital and be hospitalized on a ventilator, etc., etc. So we know the vaccine works, is very effective. How well it works against the other variants is yet to be seen, but the scientists don't believe there's any reason to believe it's going to be any less effective against hospitalizations against these different variants.
Just coming to the point you made about infections after taking the vaccine, and this has caused a bit of concern, panic. People don't necessarily understand why they are getting COVID-19 if they've taken both doses. Can you give some clarity on this? People were under the impression that once you take the vaccine, you're done. No more masking, no more COVID, it's done and dusted. But that's clearly not the case.
I wish it was, This is a misconception and maybe an assumption that everyone has sort of had or hoped would be like this. If you look at even non-COVID vaccines for other diseases, pneumonia, rotavirus, so many others, you still get the disease, but your severity of the disease goes down to a level which is very manageable and does not require hospitalization. Perhaps, the vaccine industry could have made this even more clear or clearer, in the months whilst we were developing these vaccines, but, nobody's ever made a claim or a statement or the government has ever claimed that just by taking a vaccine, It's not a bulletproof vest. What it will do is save your life, but you will still experience some symptoms. Now, you look at other drugs against other diseases also, antibiotics, so many others. If you do get, or you have an issue, nothing works 100%. It works most of the time, a lot of time, but nothing works 100%. Whether it's for cancer, whether it's for AIDS, whether it's for anything. So we are in that situation right now. What is the objective? Save lives, bring down hospitalization, de-burden the healthcare industry, in terms of the infrastructure of hospitals and other things. So that is where the vaccines are showing excellent efficacy. But to expect that you're not going to even get a little scratchy throat or a little fever, a little headache is just not going to happen. So we must explain that to people and say that, look, the good news is that it will save your life. No doubt about it.
Absolutely. I have two more questions. I know you have a short period of time, Adar, but these are important ones. One is about all the clotting with AstraZeneca, those reports that are coming, and then some nations putting on hold the use of AstraZeneca in specific groups. Have we in India seen any instances that require more investigation?
So, firstly, right now, I'm not worried, but I'm always concerned about everything that's happening with the vaccines that we make and others make. If you go back 6 months ago, there was this issue about how effective are these vaccines, 70, 80, 90%. Then there were those neurological disorders that were supposedly associated with the vaccine. In all these cases, we must respect and allow the healthcare authorities to conduct their full investigations and then finally give their reports. WHO said the Oxford AstraZeneca vaccine is safe and effective. This after, all this. EMEA said it, UK MHRA said it, and the Indian Ministry of Health, after investigation, said it. The same thing is going to be the case for these blood clots and others. And I say this because if you look at the natural phenomena of blood clots occurring in a population or in an age group or whatever, I don't see, at least I have not seen, a significant increase in the people who have taken vaccines and then got these so-called rare blood clots. Now, I'm not a medical profession, I'm not an epidemiologist, so I don't want to make a statement that, there is no link or there is a link. Let the scientific community investigate fully and decide it. Now, coming to your final point on this question, you have seen multiple countries from Germany to other European countries, Canada, so many others, suspending this vaccine and other vaccines, conducting an investigation, and then reapproving it to be used in the immunization program. I imagine this is going to be the same. However, we must wait for it all to be concluded, and I'm sure it will go on like that because let me tell you, if you asked me this question in January, how safe are we? Does it have a link to this? Does it have a cause to that? I would have said, look, I really don't know. But now, after more than 160 million doses globally that we have made, that have gone into human beings, right? Out of which I think you mentioned on your show, more than 7 crore doses, 70 million just in India alone, right? We haven't seen anything serious. So I think I'm at least relieved because, a product that we make and we're responsible for, we want to ensure that it has the highest levels of safety, and we're seeing that right now.
Last question, Adar. Are we going to have trials of Covishield on young adults and children? Some vaccine makers have started trials for children as well. Is that the next step you're looking at?
So Oxford AstraZeneca has already done that. Right now, we were focusing in India on our new candidates going through the regulatory phases because, we don't want to dilute our bandwidth too much on what we can do. Based on the data we get from Oxford AstraZeneca on a study in the lower age group probably, I don't know, 12 to 18, or maybe slightly even lower than that, we will then apply to the regulator in India, which we have not yet so far, to allow the vaccine in the lower age group. Maybe we do another small study to demonstrate that in India, or we don't know yet. We'll go by what the Indian regulator suggests we do. But if you were to ask me then, but when will this be possible? When can we see that? I would say on the outer limit, 6 months, where we would have a vaccine which might have a slightly lower dose or whatever, modified slightly so that it can be used in children below the age of 18. So I would say, ask me this question in 6 months and hopefully we'll have a solution for it, for that age group then.
All right, looking forward to speaking to you in 6 months. And even before that, Adar Poonawalla, thank you so much for speaking with us, taking all of our questions as always. And thank you for what you're doing.
All the best. Thank you.